My name's Andrew. How are you doing today?
And I'm a little tired and weak,
Okay. How long's that been going on for?
just a couple of days.
Okay, great. So, I don't see any obvious bleeding. She's talking, so she's got a patent airway. Her pulse is strong and regular. We'll go on from there.
Okay.
Do you mind getting a set of vital signs?
Absolutely. Ma'am, I'm gonna just steal this hand from me, okay?
So you've been feeling weak for a couple of days?
Yes,
Okay. What kind of medical history do you have?
I'm diabetic
Okay.
and have some heart problems.
All right. Do you have any allergies to medicine?
Not that I know of.
Do you know what medications that you take?
No,
No? Do you take medicine for anything?
and I take it for my heart and my anxiety.
Okay. Do you have a list of medicines? Or do you have them sitting out anywhere? No?
While working through our differential diagnosis with weakness patients, we should look at metabolic problems, electrolyte issues, endocrine or thyroid problems. Also, we want to consider infection or sepsis.
Another? Another? And just one more. Good job. Lung sounds are clear throughout.
All right, thank you. Have you been eating or drinking?
I've been able to eat for the last couple of days.
Okay, you haven't been able to eat for the last couple of days. Have you been nauseous or you haven't felt like wanting to eat?
I haven't been able to go downstairs and eat.
Okay.
Ma'am, I'm going to check your blood sugar and we'll see where it's at, okay? Can I borrow one of your fingers, please? You're going to feel a big poke, okay? 1, 2, 3. Okay, your blood sugar is 315.
Man, we're just gonna
All
monitor
right,
your
thank you.
breathing, okay?
Let me help you. So have you been able to get out of bed at all?
I tried, but I fell
You fell? When did that happen?
this morning.
This morning? Did anyone help you get back into bed or were you able to get back into bed on your own?
No, they had to come help.
They had to come help you? Did you hurt anything when you fell? Okay. I'm gonna go ahead and check you out and see if you have any injuries anywhere, if that's okay with you. Alright. Did you hit your head at all when you fell?
I don't remember.
You don't remember, okay. Do you remember why you fell?
I just fell.
You just fell? Did you think you passed out at all?
No.
No? Does anything that I've touched so far hurt? No? Good. Can you take a nice big deep breath? No pain with that? No? Okay, good. Didn't feel your belly?
LT, I got your first set of vitals when you're
Any
ready.
pain there? No?
Okay, go ahead with the vitals.
Alright, blood pressure is
Feel your hips.
148 over 98.
Any pain with the hips?
Heart rate is 112.
Alright.
96%
I'm gonna pull this blanket back if that's
and
okay.
40 on the cat now. Normal waveform.
Can you
Okay,
move this
copy.
leg? Any pain? No? And no pain there? Alright. No obvious injuries anywhere?
I'm gonna just add her to the 4-lead.
Alright.
Alright, man. A few stickers here. We're just gonna take a look at your heart, okay?
Are you a diabetic?
Yes.
You are, okay. Do you take medicine for your diabetes to keep it under control?
Yeah.
Do you take insulin?
No.
No, okay. So nothing you inject or anything like that?
Please.
Okay.
Square legs.
Itching.
And you just fell down? Okay. Were you on the floor for a long time? Or were you able to get help pretty quickly?
I was close to my phone.
Okay, good. I'll take that one.
There you go.
Okay.
Showing sinus tach on the monitor.
Sounds good. What would you like today? Do you want to go to the hospital to get evaluated? No? Okay. Do you think you're going to be able to get up and walk?
I think so.
Okay. Well, I think that's the first thing we'll try with us here, is we'll see if we can get you up and if you're able to get around on your own. Okay? All right. We'll just keep her connected if we can.
Yep.
Sunstar. She's an 8-year-old female. She's had weakness for a couple of days now. This morning she got up and had a fall. She wasn't really sure how or why she fell. Her sugar is elevated. I think it was 315. Vitals are okay. She's sinus tack. We were gonna just see if we were able to get her up and if she was able to ambulate, because she says she doesn't want to go to the hospital.
All right.
So that's where we're at right now.
Sounds good.
All right. Okay, so we're gonna try and get you up and see if you're able to get around on your own. Okay. All right. Perfect. I'm gonna give you a hand. All right. Do you think you can swing your legs over?
Yeah, I'll try to move them.
We're gonna help you. All right. All right. Let's give you a hand here. Feeling pretty weak, huh? All right. Let's go ahead and lay back down. All right. Okay. Do me a favor, real quick. Can you smile for me? All right. Good. Squeeze my fingers. Squeeze them with both hands as best you can. Great. Hold your arms out in front of you. Close your eyes. Keep them up. Keep them up, keep them up, keep them up, keep them up. Okay, you can go ahead and open your eyes. So she was moving everything equally. She had equal grip strength on both sides, so I think it's just a generalized weakness.
Okay, yeah.
So Barbara, I totally understand that you don't want to go to the hospital today. I can appreciate that. My worry is that with how weak you are right now, I mean, even with us helping you, you weren't even really able to get out of bed. So my concern is, if we leave you here, how are you going to eat? Your sugar's off. And what happens if you try to get up to go to the bathroom or go get food and you have another fall and you get worse, you get more injured? So that's my concern. That's why I think that we'd like to take you to the hospital right now and get you checked out.
Will I be able to eat?
Well, ideally. Hopefully we can get you there. Your sugar's a little high, so they'd want to address your sugar. But after they check you out and make sure everything is okay, I don't see why they would have an issue with giving you some food.
Could you possibly take me downstairs to eat? I'd just like to get some breakfast.
You know, Barbara, I would love to do that, but I'm really worried that if we try to get you up and you try to walk, or even if we wheeled you down there, that you're not going to be able to take care of yourself. That you could fall, and thankfully earlier you didn't get hurt, but what if this time you fell and you broke an arm or a leg or a hip? And we don't want to see that happen, because we see that happen all the time. So I would like to, our partners here with the ambulance, we'd like to get you on the stretcher and take you down to the hospital. I understand that you don't want to go.
I need to go.
I think that you do, yes.
I trust you.
Thank you. Is it okay if we get you onto the stretcher and get you down to the hospital?
I really don't want to go.
Okay.
Can't we just go downstairs?
I understand that, but I really think that we need to go.
Hey, Andy, I think we should do a cognitive.
Okay, yeah, that sounds good.
Okay, I have it pulled up for you.
All right.
Let's pause for a second to talk about decisional capacity. In this scenario, the crew is questioning the decisional capacity of the patient. So they're going to administer an EMS cognitive evaluation to assist them in determining if the patient has decisional capacity or not. What is decisional capacity? It's the ability for the patient to understand the benefits and risk of, and the alternatives to a proposed treatment or intervention, including no treatment, and has the legal ability to provide consent. Patients can be considered to have decisional capacity if they can demonstrate understanding of their situation, understanding of the consequences of their decision, and reasoning in their thought process. Capacity is assessed intuitively at every medical encounter and is usually readily apparent. However, we need to look deeper into a formal capacity evaluation if there is any reason to question a patient's decision-making abilities. Some examples would be acute mental changes, refusal of a clearly beneficial recommended treatment, risk factors for impaired decision making, or readily agreeing to an invasive or risky procedure without adequately considering the risk and benefits. After passing the EMS cognitive evaluation, doubt remains as to a patient's decisional capacity or the patient's current medical condition like hypotension, hypoxia, or a head injury calls into question the decisional capacity. Initiate contact with online med control.
All right, Ms. Barba, we're going to ask you a few questions. Some of them sound silly, but just answer them to the best of your ability, okay? What year is it right now?
2020.
Okay. What season are we in?
Summer.
All right. Do you know what month it is?
December.
Okay. What day of the week is it?
Tuesday.
All right. What's your birthday?
March 27th.
What year?
1940.
All right. Where are we right now? What room are we in?
My room.
All right. Do you know what the main road out there is? What the main street outside the building is?
No.
No? What city are we in?
Dunedin.
Okay, good. What state?
Florida.
Okay. And what country?
United States of America.
All right, very good. So I'm going to show you three things. I'm going to tell you what they are. I want you to say it back to me, and I want you to remember, okay? So, first thing is going to be radio, computer, you have a pen? And pocket knife, okay? Can you say those back?
A radio.
Uh-huh.
A computer.
Mm-hmm.
And a pocket.
Okay, great. I want you to remember those, okay? Try and remember them. The next thing I want you to do is I want you to count backwards by fives. So starting at 100. So 100, 95, and so on. Can you do that for me?
100.
Mm-hmm.
95.
Mm-hmm. Can you keep going past that?
90.
Mm-hmm. Keep going.
80.
Okay. All right, good. Can you remember what those three things I told you are? The three objects?
A pen.
Okay.
A book. And a computer.
All right. Very good. So guys, I don't think at this point she hasn't passed. She's not going to get enough points to pass the test.
I agree.
So Barb, here's the deal. Everything that's going on with how weak you are, how not well you're feeling, you didn't answer a lot of my questions right, which I don't think is your fault. Your sugars are elevated. There's obviously something going on. I think it would be best if we took you down to the hospital to get you evaluated.
I guess.
Okay. Okay. So what we'll do is we'll help you to the stretcher. We'll get you on the ambulance stretcher, and then we'll get you down there. They'll get everything under control, and then hopefully they'll be able to get you something to eat. All right?
That sounds good.
All right. That sounds great. There's that.